If you were to think about what your legacy is to be and what information you want to really impart upon people, what is so important and critical for cardiovascular and or I don't know, should we say cardiometabolic health? Because that seems to be with 70% of adults are either overweight or obese. What would you tell them? What would be the top three things that they should know about cardiovascular
Well, so
health?
I think the thing is, most people will die of either cardiovascular disease or cancer. We have the knowledge to prevent 75, 80% of the cardiovascular deaths and to reduce pain and suffering and quality of life there. With cancer, it's a little more challenging. Yes, we know smoking cessation, but a lot of the cancers now we're seeing, for example, why are younger people having more colon cancer? I mean, it's something in the food or the diet. We don't understand a lot of what causes cancers. Some of it's harder to prevent with it. Now,
Certainly a risk factor would be obesity.
so obesity is an important one, and I'll tell you. So, for example, in addition to the cardiovascular disease in my family, I had lymphoma when I was in my 40s. And so one of the things that came up after that was when talking, and no one knows why you get lymphoma. Could be pesticides, there's environmental things. But talking to my oncologist, he said, ask him, well, what can I do for, stopping a recurrence? He said, well, it looks like the people who do the best are the people who exercise. And that's probably something that you like to hear about. But
No, we don't. We're not interested in exercise on this podcast.
but after thinking, okay, let's see. And I forgot, on my mother's side, it's all diabetes. My father ended up getting diabetes later. So I've got diabetes. I already had coronary calcium when I was 39 years old. And then I have cancer. I said, and I'd always exercised some, but I'm like, okay, if it's going to make a difference, I need to get really serious about this. And so I do think the lifestyle is a huge part of cardiovascular disease, and it's an even bigger part of healthy aging. So I do think, I know you're focused on nutrition and exercise. That is our fundamental behavioral changes that we all need to work on. Fortunately, we've got fantastic medications. And this is where the genetics is really important, because if you've got bad genes, and many of us do have bad genes, there's something you can do about it now. And people understand, like in sports, and I always use I think you're new to Houston, but Jose Altuve, have you heard of him?
No. Should I?
So Jose Altuve is a baseball player.
Okay.
And when he plays for the Astros, and when he was first tried out for the major leagues in Venezuela, they sent him home. They said, look, you're too short. You'll never play baseball. And just forget about it. Height is genetic. And when people understand it, like if for height, they say, okay, he came back. The next day, because the scout said, you got to watch him play. So if you have bad genes, it's like height or something in sports, what do? Try harder, play smarter. So it's the same thing in life. If you've got bad genes, you got to play smarter. So diet and exercise are important for everybody.
But not for for everybody, but it might not move the needle for those that have genetics.
But it's still, if you don't do it, it's even worse.
Right.
So if you have a gene for familial hypercholesterolemia, even with a great diet, you won't normalize it. But if you have a terrible diet and then you get obese and get diabetes, you're in a really bad. So the issue is, but the play smarter is do the lifestyle and then find out more. Do you need a medication? Do you need what about your blood pressure? So these are the things, if you get, so I think the most important message is it's a preventable and treatable disorder. And if you've had a heart attack, there are things you can do to not have another one.
And when we think about lifestyle, let's talk about exercise. What are some of the key components to exercise?
So this is one thing, I think if you look at the residents who are rotating or working with me, they always have a little note. They say, we'd like you to exercise. And they always put in it, I want you to walk 30 minutes 5 times a week. When that's wonderful, that's a great start. But I mean, that's not exercise. I mean, that's moving a little bit. Because the funny thing is, then they say, and you should get 10,000 steps. And so they always ask me, do you know how long it takes to get 10,000 steps? Can you get 10,000 steps in 30 minutes? And of course you can't. I mean, unless you're running at it, you'd have to really be running fast to get 10,000 steps in 30 minutes. So exercise to me ends up being is that, I try to get an hour a day of exercise, and 10,000 steps. Because sometimes if I'm doing resistance work, it may not be as many steps, but then I'll walk more. Steps are great for vascular health. I mean, getting your heart rate up, sustaining it, that's very good. But I think you also need, in particular as you get older, it's like if your car gets old, it takes more, get a lot of more
Absolutely.
maintenance, So I think some of the data on healthy aging and cognition, I think exercise is doing even more than just the vascular. I think it's doing some other things in terms of brain function that are really important for maintaining optimal, cognitive
Health. I absolutely agree with you. When you talk about exercise and we talk about walking resistance training, would you say that walking is enough? How do we begin to think about taking care of skeletal muscle health?
So I think this is really a critical issue, particularly. So it's a funny thing, when I'm seeing younger patients versus older patients. Some of the older patients are like, well, I walk. And that's great. Younger people tend to go to the gym more, but it's even more important as you're getting older. So when you hit menopause, when people are getting into their 60s and 70s, 80s, the issue that comes up is now we're worried about basically quality of life, healthy aging, and things like insulin resistance, diabetes. We get into things, why do we have these issues? Well, we know muscle's critical in terms of glucose uptake, but also mitochondrial function. And, one of the things that comes up is, balance. People fall. Well, walking's good, but, you can do core exercise. There's balance exercises. You can do a lot of things where you're actually using coordination, strength. There's an issue of free weights versus machines. There's using bands. I'm working on a little trampoline thing where you're having to balance at the same time you're doing weights. So think about all the things your brain is having to do when you're exercising. But I do think is that walking is great. It's a strange thing sometimes where a lot of physicians are like, well, we can't expect patients to do more than that.
I think that's the wrong message.
It's completely the wrong message. And I think we need to lead by example. But the other thing is, if you really want optimal health, we put people on 5 or 6 drugs. That's a lot of medications to take with it. And if they were really exercising and eating a better diet, we can reduce the amount of drugs. So I think we want to give people guidance as what is optimal and encourage them to do whatever they can. But there's no sense acting like optimal is walking 30 minutes 5 times a week. It is not optimal. We don't use, 5 milligrams of lovastatin, which was the first statin, anymore. I mean, people used to, but we'd say, well, that's not that effective. So why are we recommending something that we know it's beneficial, but it's not really optimal? It's not the most effective way to prevent things or to treat things.
And what role do you think resistance training has, whether it's machines or free weights?
Essential. I think there's the issue that comes up is as you age, you lose muscle mass. So you either are gonna lose your strength. This really is just a use it or lose it thing. So this is why it may take a little more time as you get older, because you may have to warm up more and then build up and do a lot more reps instead of doing real heavy weights, depending upon if you want to avoid injuries. But it's still highly beneficial. In fact, the benefits are probably even greater as you get older. They're there all along, but I think it's even more necessary.